You can start share screening.
Okay, perfect. We'll do that right now. Okay, this. Okay, can you guys, you can see what I'm sharing right now, correct?
Yes.
Okay, perfect. All right. So we're going to be talking about podiatric medicine today, and we're part of the DPM Journey, which was a YouTube channel that we started, as well as an Instagram. And my name is Diksha. I'm a third-year podiatric medical student, and this is...
Hi guys, my name is Yona. I'm also a third-year podiatric medical student at CSPM.
Yeah. So, a podiatrist is basically a physician or a surgeon who treats the foot and ankle and related structures of the lower extremities. So what do? Podiatrists treat a wide variety of symptoms and conditions that patients have. The patients they treat can range from pediatrics to geriatrics, athletes to diabetic patients, and podiatrists see a variety of patients every day. Podiatrists can provide immediate relief to patients for their pain or discomfort, and they build rapport with their patients, okay, because they treat the same patient from diagnosis through treatment, surgery, and recovery. Many podiatrists enjoy a healthy work-life balance, working about 40 to 60 hours in a week and earning just as much as their other physician peers. Of course, again, it depends on where they're working, so we'll talk a little bit about that, I think, later. Specific cases that we do or work with is bunions, foot pain, nail care, ulcers or wounds, fractures, nerve-related conditions. Literally anything that you can think of that's related to the foot and ankle is something that we treat. Oh, I wanted to answer this. Someone had asked me earlier, a few weeks ago, whether we treat cancers of the feet. And yes, literally anything from the foot and ankle, we will be able to diagnose it and help the patient to the best of our abilities. So podiatrists can pursue surgery, sports medicine, dermatology, pediatrics, wound care, diabetic care, forensics, and a lot more. We can treat basically, there's days where we literally treat all the specialties in the same day. What I mean by that is just those different categories. We're literally looking at that every day. So, okay, practice settings. We practice in private practice, we have hospitals, emergency room, urgent trauma care facilities, sports teams, VA hospitals, and podiatrists work with other medical professionals. And the ones that we work with the most from what we've seen is vascular surgeons, because sometimes the patients we work with don't have enough blood flow, and so we have to ask a vascular surgeon to help with that. And we also work closely with orthopedic surgeons, for example, because sometimes they can work on a specific part that we don't specialize in, but of course everything's still related. Or the orthopedic surgeon and needs our help and we're helping them in surgery. It's a nice synergy that we have. Okay, Yona, take it over.
So education and training, I feel like a lot of people don't really understand what we go through for our training purposes. Some people even mistakenly thought that we actually don't go through undergraduate schooling. We do go through undergraduate schooling. And for when you enter podiatry school, we consider it medical school because you go through 4 years of that. And you take all the same classes as your counterparts, such as MD, DOs, in addition in taking lower extremity specific courses. And within those 4 years, 1 to 2 of those years will be clinical training in local hospitals around your area. And then during your 4th year, you'll be going on to externships, which is basically a month where you dedicate time to different residency programs just to visit them, work with them, see how the doctors are, the other residents are, and to see if you really fit into that program. And when you finally decide to apply for residency, these externships would have already decided if they liked you or not, and if you're a right fit for their program. And then after 4 years of medical school, you apply for residency, and residency is 3 years. And people don't know this as well, it's actually 3 years of surgical residency. So every podiatrist who goes to residency are all surgeons actually. So at the end of the day, all become surgeons. And then we have optional 1 to 2 years of fellowship. And that could range from different subspecialties such as sports medicine, diabetes, wound care, reconstruction, forefoot and rear foot reconstruction surgery. There's a lot to do out there, and there's a whole list out there. And we can share a website with you guys with all the different ACFAS approved fellowships out there.
And as far as the clinical training that he was talking about that we do in podiatric medical school, it's very similar or pretty much alike to the MDDO clinical training. The only difference is we have lower extremity specific clinics as well that we're rotating through. And it's just like, I don't know if you all knew, but MDDO, it's the same thing for them. Their 4th year, it's like an interview for residency. Okay.
So the application process, it's on a rolling basis. So that means that the earlier you apply, the better your chances of getting in. And for a lot of these schools, if you do apply early and if you do get accepted, you are put in a pool of students who are they have access to scholarship money that school set aside. So for our school, if you got accepted early and if you had, let's say, a decent GPA and a decent MCAT score, you have the opportunity to actually get $10,000 to $15,000. That's renewable every year. So it's really good that if you apply early, you have access to this scholarship money. And a big thing that's on the slide is that 99% of podiatry students after graduating are ultimately placed in a residency program. And that's due to the fact that we actually have a surplus of residency programs in the US. And you will most likely not find yourself struggling to find a residency that fits you. Requirements. Again, the requirements are not any different from MDDO schools, really. So for me, when I was personally applying, I was applying to MDDO, but all the requirements I was doing for that were actually matching the requirements for podiatry school. So I applied to all three, and it was great. It was really easy to. So just looking at some of the requirements and some of the statistics here, it's your average MCAT score for podiatry schools is around 500. Average cumulative GPA is a 3.3. Average science GPA is around a 3.2. You have to take all your pre-med classes such as biology, chemistry, organic chemistry, physics. Letters of recommendation. This is where things are a little bit different from applying to MDDO schools versus podiatry schools. For podiatry schools, I believe 8 out of the 9 schools require you to shadow and get a letter of recommendation from a podiatrist. That's just due to the fact that this is a very specialized field, and you really need to know what you're getting yourself into. And shadowing and getting that letter of recommendation from a podiatrist really shows admissions that you're really interested in pursuing this field. And then there's a personal interview, just like any other school. They're going to interview you, and that's pretty much it. Yeah,
Yeah, and it's also another reason why you should be shadowing, even if the school didn't ask you to, is because just like anything else that you're trying to pursue, you want to know that it's something you want, obviously, like Yona was saying, but it also just helps the doctor get to know you, because they need to write you a letter of recommendation and you want it to be good. And also for the personal interview, you want to know for sure why you chose podiatry over MDDO, because those are the closest to what we're doing. So they're going to ask you that question. It's almost a definite question that's going to be asked. Yeah, and also just something to keep in mind, why I also am a huge advocate of shadowing enough so that you understand that you want to do this, is because if say you wanted to switch to another specialty, towards your third and fourth years, or say you wanted to switch to another specialty in residency. You actually, as of now, cannot do that unless you redo medical school through the MDDO route. Do you see what I'm saying? Because even though we're exactly the same, we still have classes that are lower extremity related as well. And so you become a DPM. So you just need to keep that in mind. Yeah, the people that decide on podiatry, like us, are the ones who knew this is what we wanted to do. Okay.
So there are 9 podiatry schools out there. It's not a lot of us. So just looking at the schools listed on this page, there's one in Arizona, one in Miami, which is Barry, CSPM, which is in Oakland, California, which we attend, Des Moines University, which is in Iowa, Kent State. There is one in New York, one in Scholl, or Scholl College of Podiatric Medicine, which is in Chicago, Temple University, and then Western University of Health and Sciences, and that's in Southern California in Pomona. So there's not a lot of us. So why podiatry? Why would you want to be a part of this field? So first, all podiatric medical students are trained as surgeons from day one, like I said previously, through our curriculum, and by being required to complete a 3-year surgical residency upon graduation from Podiatric Medical College. That's a huge plus side for our field. I know a lot of pre-meds want to be surgeons in the future, and this is honestly a guaranteed route to become a surgeon. And sometimes if you're going through the MD-DO route, you might not have the chance to actually become surgeons, depending on your residency placement and what you get placed in. So this is a really good thing about our field. Second point, it's stress-free. And third point, great work-life balance. I think those two go hand in hand. I think podiatrists, the ones we've been working with as of recently, always pride themselves in actually having a great work-life balance and having the ability to come at home, be with their family, spend weekends with their family, and they're not on call, which is a huge deal for a lot of people who want to just relax, not have to worry about any stressful things going on. They just work a 9-to-5 job, and it's really nice, and the patients are really great. And the fourth point here and fifth point, see positive results fast. Again, podiatrists, we pride ourselves in having conservative treatments, and we treat all of our patients conservatively first before we jump into a more drastic measure such as surgery. And this is why we see really positive results quickly, because these patients usually don't want to have surgery. They don't really want to jump the gun. And just doing really easy conservative treatments is a really nice thing to do for patients. And developing personal relationships is huge in our field, because a lot of the patients we see are actually diabetics, and they require long-term care and treatment. And over this time, we develop really personal relationships with them and with their family, and we get to know their whole lifestyle, their whole life background. So it's really nice to see that end of the spectrum when seeing patients. And the ability to specialize in a lot of subspecialties. Like I said before, after your 3 years of surgical residency, you have the option to do 1 to 2 years of fellowship. Usually a lot of fellowships are actually 1 year. And again, those subspecialties range from sports medicine, wound care, reconstruction surgery, even public health, which is really cool for a lot of you if you guys are interested in that. And then ultimately, at the end of the day, you are a physician. Don't let anyone take that away from you. You are a doctor. It's within our title, Doctor of Podiatric Medicine. And again, we have to go through 4 years of medical school, 3 years of residency, optional fellowship, and you have to do an additional board certification, which can take 2 to 3 years. So you're looking upwards up to 10 years of schooling, and that honestly matches our MDDO counterparts for some routes that they take.
And 3 things I wanted to mention. Let me see if I remember all of it. When we stated that we're not on call, right? So that's not for every podiatrist, but we're saying for the most part, podiatrists tend to choose that because we tend to be people who want a great work-life balance. But the doctor that I was working with this past month, I was kind of asking her a lot of questions about what the profession can be, because she has been working for over 20 or 30 years now. So she was able to tell me, right, about all of this because she's seen so many types of podiatrists. She was saying that you can choose. That's the beauty of it all. You can literally choose however you want your podiatry career to go. She knows a lot of podiatrists who choose to be on call, and they like trauma. And so that's their cup of tea, and that's what they do. So you can choose. And then as far as, what's I gonna say? Once you're, oh yes. So in residency, yeah, I don't know if Yona mentioned this, but in residency, we work alongside residents who are MDDO residents as well. And that's why we like to mention that, yes, maybe as a pre-med, there's still some misconceptions about podiatry. And maybe in medical school there might be, maybe there's misconceptions out there, but once you're out in the real world, once you're an actual podiatrist in residency, barely anyone is asking, or barely anyone doesn't know what you're doing, because you're literally working with MDDOs who are from all different specialties. Okay, so the beauty of it is, again, I'm going to emphasize this, we start learning about surgery and lower extremity specific topics since day one of school. That's why it's so cool, because we've been training for so long to get to where we are by the end of our third year of residency. And honestly, for me, that really worked out, because I like to know that the biochemistry I'm learning can actually be applied somewhere, because I'm also taking those courses, or I'm going to the workshops my school's offering where I can actually do hands-on techniques. And so I think that's really important to molding you into the physician you want to be. And that's another thing I really like about podiatry. Sometimes you can be stuck in your books and not realize, what's the point of all of this? Why am I learning about genetics? Okay, maybe not genetics, that's a little more related, but you know what I'm saying. Okay, so if you have any questions after this meeting, you can follow us on Instagram also, by the way. We share a lot about the ins and outs of our lives, the DPM journey. You can email us at thedpmjourney@gmail.com if you don't like Instagram. Then we also have our YouTube, The DPM Journey, where we discuss and take you through the ins and outs of our days. That's something we're really trying to do more of. I'm trying to vlog a lot more, and so that should help you guys a lot with deciding too, especially during COVID, if you don't really get the chance to go into a podiatrist's office. We'll take you through that. Okay, so we're gonna open this up for any actually, one second, sorry. I wanted to show you guys photos we have on our Instagram of what we do. So this isn't that big of a deal, but this is us checking reflexes. So that's something that we learn how to do. We learn how to tape. Taping is one of the conservative measures that we're talking about. We treat a lot, if you want to, you treat a lot of athletes. That's something me and Yona, I think, are kind of interested in. We learn, so this is actually something we do for infants and for younger kids. It's for clubfoot. And so we the simplest terms, we put on plaster casts as they grow older, and it's really cute. We were working on this little model. It's so tiny, adorable. But this is for Podiatrics, and again, it depends on your practice, but I'm sure you'll at least once see a clubfoot case. These are all the tools that we use. This was us practicing suturing on pigs' feet. So that's, of course, something we have to learn early on as well. And we have to inject patients, obviously, for various reasons. A huge one is cortisone injections so that they find relief. There's conditions like plantar fasciitis that are very common that patients come in for, or if someone's coming in with an ingrown toenail. These are just basic cases that we see, but we of course have to inject them with anesthetics for that. Oh no, don't freeze on me.
It's okay. We can
Yeah,
answer
anyways,
questions.
so while I'm looking for stuff, do any of you have questions that you'd like
So,
to ask us?
so far, there's one question actually in the chat.
Oh,
It
sorry. Okay.
do podiatrists have clinics, or do most work hospitals? Wondering due to the ability to schedule for more balance. That's a great question, and I think it. I think so far, based off my experience in talking to doctors, a lot of podiatrists actually coming out of residency work at big hospitals to really get a solid footing in this field and really try to get their experience better and treat as many patients, different types of patients. And once you have those connections and once you've established yourself and have some money to open up your own practice, I think most podiatrists do try to lean towards that route of opening up their own practice, having their own private practice, because that way they can be their own boss and have a better balance with depending on their schedule, and B, it's really nice because you can see certain types of patients and really specialize in something that you want to do. So, for example, the doctor that I'm working with right now, he sees a lot of sports medicine cases and he loves doing that and he rarely sees wound care. So, that's if you like doing that, you could definitely do that. You could pursue that. That doesn't mean he can't do wound care. He just chooses not to see as many wound care patients as he's seeing sports medicine patients. He likes seeing athletes, so it's something that he really likes. Do you have any suggestions for good questions to ask podiatrists when you're shadowing, or any general tips when learning about the field? That's a great question. And I made a YouTube video about this for shadowing a podiatrist, which you guys should check out. But some really good questions I would definitely ask is, how's your work-life balance? What's your schedule look like? I think that's a really big thing for a lot of podiatrists. Um, what's your surgery schedule look like? Are you doing surgery every day? Are you doing surgery just once a week? How many surgeries are you doing on days that you're doing surgery? I think that's a really good question. Also, how many patients are you seeing a day? I mean, the podiatrist I'm working with right now actually sees 30 plus patients a day, and that's a lot of patients. But some of these podiatrists can see 15, 20 patients. So it depends on the range of patients that they're seeing and if they feel comfortable doing that. Um, Another one is, are you working in a multi-specialty clinic, or do you rather prefer to work in a hospital, or do you rather prefer to work in a private practice? These are questions that I would be thinking about as you're going through that. Another one is, again, why podiatry? Why did you decide to get into this field? That will help you honestly with your personal statement when you're answering that question. It's for all 9 podiatry schools, and that will just give you a sort of idea what would admissions want to look for or hear about. I think that would be a clever way to sort of get an angle on that. Diksha, do you have any more questions that you'd like to add?
I also, for learning about this field, I think it's, yeah, when you're shadowing, which I haven't been through it yet where you're doing it virtually, but if you're doing it virtually, you should probably ask questions about what kind of cases, again, I think Yona may have said this, but what kind of cases that they're going through, and that sort of thing. And maybe also try to look that up. I don't know how much information's out there, but we can definitely try to help with that if you have any questions for us. But anyways, the podiatrist will tell you what what kind of cases that they most often see, or what they could be seeing if they wanted to, because that's really important, because again, that should help you decide if this is something you're interested in. For me, the first day I shadowed, I didn't learn anything, I didn't learn anything, sorry. I was afraid because I didn't understand what was going on. And then I saw a foot that was about to be amputated, and that scared me. But then when I came back another day, I started realizing what it was all about. I got used to it. So it's that sort of thing. You just want to ask about what cases they're going to see. That's really it, I think, is very important. And yeah, and seeing if they like, how they like the field and how they found out about it. I think it says a lot about the field if you ask them those kind of questions too. And also I put in the video that he was talking about for shadowing. I put that in the chat if anyone wants to look at that.
No problem, guys. Do you guys have any more questions? Don't feel shy or anything. Ask away. As ridiculous as the questions are, we've gotten so many questions up to this
Yeah.
point that we're used to it. So just ask any types of questions, and we don't mind answering them. Anything about the MCAT, anything about schooling, just anything that's on your
Pre-med.
mind. Yeah.
Yeah, we understand how it is as a pre-med too. It's a lot that was going on back then.
When did you guys specifically decide you wanted to be podiatry students? Or going to podiatry?
That's a great question. Just personal background on me. I've had 5 foot surgeries, and all 5 foot surgeries were actually reconstructive or flat foot reconstructive surgeries. And I learned a lot through that experience. It was really tough for me to really bounce back after the first 3, to be honest with you. But you really learn a lot when you're going through a traumatic experience like that. I was a very young individual going through that, and from those experiences, I knew for sure I wanted to be doing something with the foot and ankle region. And seeing that all the doctors I was seeing at the time were all orthopedics, I thought, okay, definitely going the orthopedic route in pursuing medicine. But my friend during my 3rd year of college actually introduced me to the world of podiatry by saying like, oh, there's podiatrists out there who actually look and specialize in the foot and ankle. And I was like, oh, that's so weird. I've never heard of these people. And I tried searching them up. And there's not a lot of information out there during the time when I was searching it up. And so I thought, might as well just shadow podiatrist, my local podiatrist and around my area. I shadowed 2 for 3 months or 3 to 4 months. And from there, I just really fell in love with what they were doing, the types of patients they were seeing, and the ability to do clinic plus surgery, which was an amazing option for me, which I really wanted to do. And so I pursued the field of podiatry when I was applying. I applied to MDDO and DPM, and ultimately I chose DPM because I thought it was more fitting for me and more fitting with my experiences and what I've been through in my life.
Yeah, quickly, I did want to mention, you reminded me, Yona, thank you. Why would you, so some people might have the question of why would you choose podiatry over orthopedics, for example? Why wouldn't you just go the MDDO route and do that? So a big reason why people might not want to do that is because orthopedics is it's a very competitive specialty, as you may know. So when you start medical school, you'll understand what I mean when I say it's like drinking water out of a fire hose, and it's hard, and not everyone can be the top of their class. And so that's the hard part. You might not match into orthopedics, and that's the difficult thing. Also just knowing that we actually, since we're training from the beginning to be podiatrists, we don't our residency isn't as long. And when we're doing our residency, it's podiatry focused. So we are literally, when I say we're literally the best trained to treat the foot and ankle. If you want to specialize in the foot and ankle and you're in orthopedics, you would have to, how many years is it, Yona? I forget, but
It was like
it's several years. I'm sorry.
I think it's like 1 to 2 more years, or maybe 3 years.
Okay, well,
Like
yeah,
general
so
specialized.
they do like the general orthopedics, right, which you have to do. You have to learn all of the orthopedics first, and then they would go on to specialize 1 or so years for foot and ankle. So that's another benefit that you would get from doing podiatry if you know that you enjoy the lower extremity region. So for me, what got me into it is I have a long weird story, but I'll try to cut it short. I didn't know. When I was in college, I actually did not. I had all these stereotypes in my head and misconceptions about podiatry. It was something I wasn't even trying to look at. So that's why I can understand where I need to come from with students who obviously don't have the exposure because yeah, we're still trying to work on that. But back then I didn't even want to look at it. And I had friends who were actually deciding on podiatry. So I got lucky in that way because I went through a special master's program. I did a post-bac, and I was thinking that I was going to attend a DO school. And then at the time, instead of actually applying for DOMD, I think I only applied to that one school I was doing the special master's program at. And at that point, that's when I was looking at other options instead of applying, which I don't suggest you do. You should, if medicine's what you want, you should apply. But for some reason, I was looking at other options like, okay, maybe I want something outside of healthcare. And at that point, my friends were talking about podiatry because they had already been through it for 1-2 years of schooling. So they were trying to suggest, Diksha, maybe you should check out podiatrist in shadow. So I went ahead and did that. And again, like I was saying, I was scared at first because it was something like, to me at first I was like, oh, the feet are disgusting, or I had all these, I was confused. And when I finally saw the beauty of what we do, there's just nothing could touch that. I love the fact that we can get our patients happy within the same visit. It's the strangest thing. I was talking to my doctor the other day, and she was saying, you know, you'd expect that if you did a Lapidus, which is, it's a surgery, it's a type of surgery. She was like, you would expect people to be happy, the patients to be happy if I did a Lapidus, but they're happy about it. But the patients that find the most happiness from what I do are the patients I cut toenails for, or I treat their wound for, the patients who really need help with standing on their feet. Because you might not realize it, but calluses, the pressure points on our feet, just like even just cutting a toenail or a hangnail, or a lot of the patients that come in have some sort of dystrophic nails, and or they have something going on that you might have not thought about. I never even thought, it didn't even occur to me that things could happen like that with patients' feet. But when you think about it, our feet are covered most of the time, so you won't realize you're just walking across the street. There's probably a bunch of people that have some sort of lower extremity issues. And we treat them immediately in one visit. I can't say that for a lot of specialties. So I'm very, very fortunate that I found podiatry in that way. And yeah, and then that work-life balance. And for me, I wanted something that, at first I wanted to be a general physician. This is very similar in that you are seeing and treating and managing so many conditions. I needed that variety, and that's what podiatry gave me. You can do everything under the sun. So it's a lot of fun all the time. I hope that answered that question. Sorry if I talk too much.
Yes, thank you.
Okay, great.
What activities were you guys involved in like undergrad and stuff?
That's a great question. For me, For undergrad, I was part of a research team for plant microbiology and also cancer oncology, which I did about 2 to 3 years of my time in college. Also, I was part of a cooking club. I started a cooking club on my campus with a few other students, cooking for students who were freshmen and sophomore, for who were freshmen and sophomore. And that was really fun because, again, I think a lot of people don't know how to really cook for themselves besides ramen, and that's a big issue. I've been there, done that, but that was really fun. Also, just working with our school and trying to really meal prep for other people and show them how what's like a really healthy lifestyle is really crucial to do well in school, I think, in my opinion, because eating healthy is really good for you. Um, what else? I also volunteered at my local hospital for 2 years, serving on the ICU floor, helping patients out and helping the nurses around there and the doctors. What else? I also did community service work around my area, which was in SoCal, just helping out with just my local community, helping them with things like building houses or attending some of their services and just helping meal prep for other people on weekends. So those are some of the few things I did for my extracurriculars that I really enjoyed doing. Also, on that note, I would say try to commit a, a, a good period of your time in doing something. Again, a lot of admissions don't want to see that you just committed to something for just 1 month, unless the thing you were committing to was actually for 1 month. But don't just volunteer at a hospital for 1 month. Try to do it for at least 6 months to a year. I think that's really important versus like if you have two quality extracurriculars on your resume and you worked on those extracurriculars for a long period of time and you've established great connections with the people that you were working for or you were doing it with. I think that goes a longer way versus having like a million extracurriculars and just doing those things for 1 to 2 days. I think that's something that you guys should hopefully be aware of when you're applying to any medical school, MDD or GPM. A lot of admissions want to see the quality time that you put into these extracurriculars. So that's something that I will leave with you guys when you're going through your college career.
Yeah, they can see right through you if you've done a few days here, a few days there, and then that's all you've done, or if you just keep switching. It's fine to switch. I'm not saying that's wrong because you're trying to figure yourself out. But at the same time, if that's all you have on your application and you never ended up figuring yourself out, then that's a problem. So what I did was I also did several things, but I'm going to mention the bigger activities. So I was part of a mental health organization called NAMI, and I helped begin that organization at my school. I went to UC Davis, so I started that, and I started off as a secretary, and then I went on to become the president, and I started a mental health fair and everything. So that was something that was passionate for me. That's another reminder: do something that you want to do, not because it's something that you were told to do because you're pre-med. You don't want to just check off the list of things to do. Okay, so there's that. I also, back then, I didn't listen to my own advice when I was younger, so I decided that I needed to do research, and it had to be, I thought it was something that I was interested in. And so I looked towards the mind studies and that sort of research that we had at our school because I was a neurobiology major. But the one that I found ended up being a little against my morals, unfortunately. But it was about autism. So I did that for 2 or 3 years, surprisingly enough, even though I'm saying it's against my morals. But again, like I didn't have anyone tell me back then that you don't need to fulfill this just because you were told to do it. So I did that, and then I really enjoy dance. So I was a choreographer for a lot of our cultural events, and I participated myself as well. And I was a mental health worker for a year. Again, I don't know if you guys see a trend here, but I really enjoy destigmatizing mental illness and promoting mental health. So that was something I did that I really enjoyed. It took a lot of time, so I made sure I did that after college, though. I did that for a year after I was done. I started off when I had a lighter load. Yeah, so those are the big activities that I did. And I also volunteered for a mobile clinic. So that's an option for you guys too. Those are a lot of fun because you can see distinctly what you're doing, and it's kind of hands-on. You're learning some technical terms. Of course, you can't do a lot, but you still learn a lot from clinics, student-run clinics.
So what's your message to pre-meds for pursuing podiatrics or podiatry in their future? Big thing is shadow. You really need to shadow like podiatrists, anybody in the MD or DO field. Again, you want to really know that you're committed into pursuing a specialty such as podiatry. It's a very specialized field. Like I said, it has a very particular focus, which is in the lower extremity region. And you do not want to find yourself, again, 2 to 3 years into medical school with $300,000 in debt, and there is no plan B afterwards. You either keep going or you restart in another medical route that Diksha previously said while we were giving the presentation. So I think, sorry, my throat is really dry. Shadowing is really crucial, and it will really allow you to really know if this is the right field for you. And you will be able to ask a bunch of questions to whichever doctor you're shadowing, and that will just make you feel more comfortable knowing that this is the right profession for you. So I think shadowing is really key for you pursuing for you pursuing this field.
And then another side for that is also it, don't listen to other people if they tell you whatever they tell you about podiatry, because guaranteed they don't know what podiatry is if they're telling you anything against it. That's the thing. If you want to know about podiatry, if someone says something strange to you, just come to us, come to the podiatrist you were shadowing and ask them if this is true, whatever this person said was true. People might say things, but again, remember who you're hearing it from is probably someone who is a probably fellow pre-med. Pre-meds don't know. Okay, I can guarantee you pre-meds have no idea what they're talking about if they're saying something against podiatry, because there's not enough information out there for pre-med students. You're only going to know if you experience it firsthand. So that's why we recommend shadowing. And also, while you're pre-med, is just a little piece of advice for the rest of your life. Believe in yourself. You are the person who needs to believe in yourself the most. There's going to be a lot of things that hit you in life. There's a lot of challenges. But as pre-meds, as med students, it doesn't end. It doesn't end. It's going to happen throughout your life. There's going to be people that talk down to you. It doesn't matter what field you choose, there's always going to be someone saying something and judging you for something. So it's important to have a support system so that you can lean on them and just ignore the rest of the people and keep pushing. You can make it into medical school if that's what you want. Okay, you can make it into podiatry if that's what you want, and any other specialty.
The next question is, do you get more wound care and derm related patients or more bone and muscle related patients in podiatry? And that's a great question. I think a lot of people would think we'd get a lot more derm and wound care patients because a lot of the patients we're seeing again are diabetics with peripheral neuropathy, and they develop a wound on the plantar side of their foot, or we're dealing with people who have just dystrophic toenails and they have just ingrown toenails or some sort of conditions of their feet that's skin related. And yes, we totally get all that. It's definitely common to see that in our practice. However, the person I am shadowing right now, like I said, is a heavy sports medicine type of doctor, and he sees mainly bone and muscle related patients because you can think about it. Athletes are mainly coming in for inversion sprains or eversion sprains or Achilles tendonitis or stress fractures due to overuse of their foot. And these are very common things that we see in athletes or just athletic people in general, or people are just hiking casually or running for long periods of time for weeks on end. And there is that whole other side of things. And that's the incredible thing about podiatry. He works in a private office and he gets to see those types of patients. And one of our professors at school is did a fellowship in sports medicine, and he was actually a team doctor for, I believe, the Giants or the Warriors for a good period of time. And he was doing, I don't really remember, but he was part of a sports team, and he was traveling with them for I believe a few years actually, and he was obviously just seeing bone and muscle related things. So you can get both sides of the spectrum, and it just really depends on where you're working at, what you like to work on, and your patient clientele. So hopefully that.
Exactly. Yeah, and I have another, so Yona, it's funny because this past month, Yona was with a doctor who did all the sports medicine, and I was with the doctor who got all the other patients. And she's really cool because she taught me that as podiatrists, it's okay that we just choose to do what we want to do and send other patients off to another podiatrist who might do it better. As she was saying, she's like, we all have something that we're experts at, and it's okay to share it with your colleagues. So so for her, it's what she always gets is patients, like I was saying, ingrown toenails, or patients who have wounds that need to be looked at constantly. There was a cool, this is a perfect example of what podiatry is all about. So you would think when you're treating a wound, as someone who's not in podiatric medical school, you might think when you treat a wound, it's just derm. That's all you're thinking. That's it. But actually, it has a lot to do with your biomechanics. Like, what I mean by that is like the physics of our feet. Okay, so what the doctor was doing that I was working with, there's a patient who had an ulcer at the tip of his toe. Okay, so the reason he had it was because he had a hammer toe. So he was always putting pressure on the tip of his toe, and it ended up cracking and creating this ulcer. So what she ended up doing is going through, and it was an in-office procedure. She ended up cutting his tendon so that his toe would end up sticking out a little more, and he would end up not putting pressure on that toe any longer. So the cool thing is that we literally just put everything together in podiatry, and that's a constant thing. We're always thinking about, okay, does this patient need surgery, or is there another way to do it? This patient didn't want surgery, so we just did an in-office procedure. But there's an option to amputate, like we were saying. That's something that we unfortunately may have to do sometimes. Yeah. But it's all about what you want to do in your practice. That's the main point.
Are there any other questions? You guys can feel free to unmute yourselves and if you'd like.
And these are great questions, guys. Just keep asking away. We love answering these types of questions, and there's no bad question here, to be honest with you guys.
Yeah, literally. We're not going to be offended or anything. Is there anything that we haven't answered about podiatry that you guys are wondering? Anything about our schooling? About work?
I think you guys answered every question pretty thoroughly.
Okay, I'm glad to hear that.
We
And
like to hear that.
again,
You want to say sorry?
no, go ahead, go ahead.
Okay, I can just finish what I wanted to show you guys. I'm gonna share the screen again. Where is it? Okay. So just to keep like continuing on with more of what we do. So this is what I mean by us doing conservative measures. So sometimes there's pain in a certain part of the foot, right? So we use things like this. We use felt pads often. And here's an example. We have felt pad right there. And I think he was just taping around it to keep it stable. I don't know if you can see that, but this is one of the examples of how we use felt pad. He's using a foot model here. And then this is us being trained our second year. Wait, was this second year? Yeah, it's the second year. We're learning surgery techniques, just the proper way to go through surgery, how to transfer a patient, help the nurses and the other staff on our team. And then, where did we have, okay, let me go back and look at things. Here, this is a good one. So this is what we did earlier on this year before. This was our rotation when COVID occurred, unfortunately, so we had to stop it early. But so we were learning, this is our general medicine rotation. So we were learning how to check patients, do the full workup on a patient. So that's what was going on here. And this is, again, checking reflexes in our neuro class. Okay. Do we have any specific, where was that? I thought we had more. Oh, you know what? The perfect thing to show you guys. I know the perfect thing right now. Okay. Oh yeah, well this was in the OR. So we just completed our OR rotation. So we go to the OR a lot more after this, but this was just our OR specific month that we did. Okay, I skipped it. Whoops. Oh, okay, that's what our photo was about. But yeah, that was OR specific. So we learned, again, the scrubbing techniques. We learned how the dynamics are within the OR team in the room. So here's something just to give you guys a quick look at what we do. Let's see. Can you hear? Oh. So vascular testing. We test the blood flow. It's one of the big things we do at every. Oh wait, I skipped. So radiology is big. We have to test. Maybe I'll mute that. Okay. We have to test and study and diagnose through looking at radiology, and then reflex testing again, as we were talking about. Again, we administer injections for specific things. We check protective sensation often. We administer orthotics because, again, that's part of helping patients, and we examine their biomechanics. We can prescribe medication. We have to often prescribe medication. That was our salary. And then we do surgeries. So this was Dr. Ebony, by the way. Oh, that's what I was going to tell you. If you haven't done this yet, I would suggest that you watch Your Feet Are Killing, or My Feet Are Killing Me. I think that's what it's called. It's important because that will give you the best examples of some of the more critical cases that we look at, and it's pretty good indication of what we do, I feel, but a dramatized version of it. So these are just some surgeries again that we work on. Okay, and then just completing that, yeah. So there you go. That should should help. Okay, so any other questions now that you've seen that? Is there anything that you'd like to know? By the way, I just want to tell you, your I don't know how to say your name, but your Nishia, I really like your name. It's very pretty.
Thank you for letting us host you.
No, thank
Uh,
you so much, guys. We really appreciate it.
y'all did
And
a great job of representing the specialty.
no, thank you. Yeah, again, we love doing this. We're very passionate about just educating and spreading awareness about this. And again, thank you so much to all of you who came out, and thank you so much, Pre-Med Scene, for hosting this, because we really do appreciate platforms like this that give us a voice to just share the information like this out there. There's not a lot of platforms out there really sharing this type of information. So again, we really do appreciate it. And if you guys, again, if you guys have any more questions, just feel free to message us at the DPM Journey. And if you like and want to learn more, you can also watch our YouTube videos at the DPM Journey.
Yeah, and definitely subscribe so that it'll notify you when you get, or so here's the thing, you have to subscribe, but also hit the bell icon. And that way YouTube will tell you when we upload new videos. And you could also just tell us if you want something specifically done for you, and we'll make a video about that.
Yeah, a lot of people who give us feedback, we try to make videos for them, or try to make videos for that specific topic, they say. So yeah, we just like doing it as a fun hobby.
Yeah, and follow us on Instagram, because we do like to, show you guys what it's like throughout our studying and throughout clinic and everything. So you get an insider's look that you might also use. So it's like two sides. You get one on YouTube where we have a lot of information, and an Instagram where you see our lives outside of the computer, I guess. Yeah. Okay. Well,
Have a great day, guys. Thank you so much again. And
take care.
we
Thank you
hope
so
you guys
much.
take care.
Yeah, I appreciate it.
Thank you.
Yeah, no problem. Thank you again. Take care, guys, and stay safe out there.